Hi guys, my name is Audrey Starkey and I am the CEO of Starkey Medical. I am here to share some great information with everybody. We recently just purchased a new EHR system. We hope to implement that system in our clinics and hospitals as early as May 1st. This new system has some great advantages that the old system did not have. I know this is scary. It's a huge thing to get a new system. It takes a lot of time and effort to understand and learn every aspect of the system, but I have faith that all of you are going to be just fine. This new system is great with administrative concepts. Admissions with this system are going to be the touch of your mouse. With one click, you will be able to check in patients. You will be able to copy schedules. If you have a patient that is used to having their appointment weekly on Tuesdays at 10 o'clock, with the click of a mouse, you can now copy those appointments and paste them through the month, through 6 months, through the year if you like. This new system has a great claims generator. This will make easy for all of our billing specialists. This claims generator is the same. It is 3 easy steps to submit a claim electronically. 4 steps if you have to print it and mail it. But our old system took about 6 steps, so this is going to be saving time and effort for everybody. This new system has the best communications platform I have ever seen in an EHR. Emails are sent out directly from the system. While getting demographics for each patient, we will have the patient provide their email, and instead of having to go to your Google platform to send the email, you will simply open up the EHR system, open up the demographics of the patient, click in the messaging portion, and you will be able to send emails, text to that patient if we have a cell phone number on file, records to that patient's other providers. We will be able to have telemed visits through the communication system that will be secured platform instead of having to use Zoom or Google or anything like that that's not secured and is not HIPAA compliant. This new electronic health record system will be compliant with all. This new system has support, decision support. It has all the information of medications, allergies, risks that the patient may have. It has all of their screenings that they've done. Now, say your patient comes in and they have a list of 20 medications. Instead of us asking them, what medications are you currently on? We can pull up that list in this new EHR system and we can see what medications the patient is picking up. Of course, we still have to ask them, even though they're receiving those prescriptions from a pharmacy, are they taking those medications? Either way, it helps us be more cautious to not prescribe medications that may counteract with the medications that they are currently receiving from their pharmacy. It helps us with a lot of the screening. If you have screened your patient for certain diseases in the past, we have all those records on file at the tip of our fingertips. We don't have to go to a different platform and search through medical records. We can just open up the patient's record and find that it's there. This platform also has links to dentistry and optometry records. If your patient is seeing somebody in one of our clinics that has a dentist or an optometry clinic, all of those records will be linked. We will no longer have to call the optometry clinic up on Dr. Martin Luther King Jr. Drive to get those records faxed over. They will automatically be in the system already. That's great because I know from working in a medical clinic as admin staff before, what a pain it was to get a hold of somebody in the clinic, request the records, have the patient fill out a release of information. then call the clinic again, fax the release of information over, have that doctor fax the records, or have whoever clerical staff in their office get the records faxed over. It was just a huge mess. This is going to make things super easy for us. This new system has health info and data platform. This is where we're going to store all the demographics. We're going to have the patient's name, date of birth. We're going to have their address, phone numbers. We're going to have a mailing address if that's different from their physical. We will have who the guarantor is. We will have all of their insurance information. We are able to store primary, secondary, and tertiary insurance information. That is huge. The old system only let us share primary and secondary, and a lot of our patients would be perturbed that we didn't have the room or the capability to bill their tertiary insurance. A lot of that tertiary insurance picks up 100% of what the patient is responsible for. I know a lot of elderly patients, their copay, even after the secondary insurance, is a $20 or $25 copay. A lot of them lived on a fixed income and they're unable to pay that. So being able to store this tertiary information and be able to bill out to tertiary insurance, this is huge. This can save a lot of money for a lot of our patients. The health info and data section will also have medications and allergies. It'll have the results of everything, the tests that they have had, the blood work that's been done. Everything will be in that demographic portion. You'll be able to access it very easy. Order entry management of this EHR system. Instead of us giving the patient their lab orders on a sheet of paper and then having to take these lab orders to the lab to get their lab work done, we now will create the lab order in our EHR system and electronically fax it over to the labs so that the patient doesn't lose the paperwork. This system will also allow us to remind the patient 24 hours before their lab order is due or before their appointment to get their labs done, to fast for that 24 hours or only drink water or, whatever the restrictions may be for that patient. We can send the patient a reminder through our system so that they ensure that their labs are done properly. This also has great patient support. This patient support is like none I've ever seen. And that's why we're here. We're here for the patients. We want our patients to be our top priority. This new EHR system shows us everything. It tells us what discharge instructions the patient has had. If they've had a surgery, it tells us what that surgeon gave them as discharge instructions to send them home with so that we can follow up with the patient to make sure that they are following those discharge orders. We can telemonitor through this new EHR system. That is the greatest thing I've ever heard for a lot of our patients. Some of our patients, it's hard for them to get up and moving. They've just had surgery. They're elderly. There's a lot of different reasons. But with this new EHR system, and us being able to telemonitor them, to have telehealth visits through our EHR system is huge. This is something so great. Once you guys get to use the application and see how great it is, I hope you're as excited as I am, really. This also has a lot of computer based learning with the EHR system. Integrated into our EHR system, we have different applications. We had MedBridge Go that allows our physical therapy patients to get onto their MedBridge Go through our website and pull up the exercises that their therapist has given them so that they can watch videos and be instructed of current ways to do of the correct ways to do their physical therapy exercises. It has a lot of different learning platforms. We have platforms that show different ways for the patient to eat correctly to help control their diabetes. It has so many learning platforms, I can't even think of all of them to mention all of them. This new AHR system has a results management platform that shows everything. The patient can also access this from an out of office site. They would log on to our website, and it's kind of like all of their medical records that they have, they're able to access everything. Majority of what they have, the lab records, their discharge records, the computer-based learning stuff, their diagnosis, what medications they've been taking. They're able to access all of that as well. So that's great. Population health management. This new EHR system does something I've never seen before. It automatically reports if it notices that we have so many patients coming in with the same disease or so many patients coming in with the same symptoms. It's going to use an algorithm that is created within the EHR system to decide if this could be something potential for bioterrorism, or if this is a disease that we need to surveillance. Right now, we are dealing with the COVID-19 pandemic. This new AHR system would have caught all of these red flags, the high fever, the chills. It would have caught the upper respiratory infection, the sneezing, coughing, wheezing, headache, shortness of breath. This would have caught all of this. And with that algorithm, it would have implemented all of those together and gave us something to watch for so that we could have noticed how many patients were coming in with all of these symptoms. So this new AHR system, it's great. I'm so excited about it. There's so much more that I'm probably missing, but I didn't really have a lot of time, and I just wanted to touch base with you guys. And like I said, let you guys know that I'm really excited about it and that it's going to be great. And then I know it can be stressful. I know it can get a little overwhelming when you're trying to learn something new that's as complex as this, but we'll all get through it together. If you have any questions, if you need any help, feel free to reach out to any of your management support team. If you're having problems with that and you're not receiving the help that you need, feel free to reach out to me. I'm happy to help. I hope you guys have a wonderful day, a wonderful weekend, and look forward to May 1st when we start implementing this new system. Thank you so much and have a great night.